Thank you. I'm here with Roxanne Khamsi. She was the chief news editor at the Nature Medicine. She now freelances and she's coming to us from Montreal. I want to thank Joseph Bonner, my co-chair at Science Writers in New York, who's behind the scenes and doing the YouTube feed and also setting up the Zoom. Roxanne's articles have appeared in publications such as The Economist, Wired, the New York Times Magazine. She's won awards, including the American Medical Writers Association's Walter C. Alvarez Award and a first place award from the Association of Healthcare Journalists. So she has taught at Stony Brook University's Alan Alda Center for Communication Science, at the Craig Newark Graduate School of Journalism, at the City University of New York. She earned a degree in biology from Dartmouth College with a concentration in genetics. So I asked Roxanne because she's been reporting on COVID. I think your first article was in February.
Yeah.
And what made you report on that? That was for Wired, right?
Yeah, it was. I think it was February 8th that it went online, and it was a unique way that happened because I had just started reporting again. I was an editor until mid-December, and I decided to switch gears and become a reporter. And I moved countries, so around that time, so I just had landed in Canada and was getting used to the fact that I was in a different country, and spending a bit of time on Twitter and noticing a lot of videos coming from China and watching, when the day was done, I would just kind of watch videos from China. And then I started to get a sense that there was something really serious going on there. And, reading some of the early tweets and reporting from folks like Helen Branswell. And I started to notice that things were happening, and also that it was a coronavirus, which kind of got me nervous because I had been in a meeting 5 years before. And I just happened to have a conversation with a virologist who really put the fear of God in me about the potential for pandemic coronaviruses. And so I was just on Twitter on like a Friday night, just kind of trying to battle misinformation. And I don't usually do that. Like, it just felt kind of like a spur of the moment thing. And then an editor of mine, Dan Engber, reached out to me and said, hey, you seem to have a lot of thoughts about how this new coronavirus isn't necessarily like a nothing burger. Like, he said, maybe you should write a piece about how it isn't worse. It isn't as, or a lot of people at the time were saying that flu is a bigger concern. And I was on Twitter kind of just speaking my mind and saying, actually, it might be worse than flu. And he asked me to write a piece for Wired, and I did it. And that's what started me going in this direction.
So, a lot of people ask me, how is the coronavirus, because the flu is a virus also. So how is the coronavirus different from the flu?
Oh, I mean, that's a great question for a virologist to give a whole lecture series on. But I think, are you talking about how it affects us differently, or how the virus itself is built differently?
No, it's affecting it. It's. I mean, like in your article, you talked about how people said, well, Ebola is bad, but the flu is worse. And they're saying the same thing about, early on, they were saying, well, there's just as many, a lot of people die from the flu. This is not going to be a big deal. That was the thing that I was getting from people. And
yeah, I mean, to me, it was just again, having seen a lot of the stuff on Twitter in China, a lot of those videos have been taken down since, by the way. I have a spreadsheet that I keep that, up until in the first couple of months, I had video links that I was saving and articles. I had 400 different things filled out in this spreadsheet. And I went back a couple of months ago to check out those videos, and they were taken off. But, the early signs from Wuhan were that the case fatality rate was higher than the flu. And again, nobody could make broad generalizations, but I knew that the original SARS coronavirus was pretty bad, worse than the flu. And so I was kind of I guess I've been doing it continuously, but I kind of look back to the original SARS to kind of use as a template. And so that one was obviously much more fatal than the current SARS that were SARS-CoV-2. But I guess in terms of how it was different, how it seemed different to flu, from flu for me at the time, was that it just seemed a lot potentially more devastating. And I think that we've kind of seen that seems to be the case.
Yes, there are 18 million cases in the world right now, a little bit over that, and 694,264 deaths. In the USA, we have 4.8 million cases and 94,000 deaths. But in Canada, we had 117,000 cases and 8,947 deaths. That's as of today. So what's the, I mean, so you started writing, about the, it wasn't a pandemic when you were writing about it, but
no, but I was worried it was going to end up that way.
Okay. And, so a lot of people don't really, there was a pandemic that I was in 1968, and but it was a very mild, lots of other, because I don't remember it. They held Woodstock in 1969 during a
flu.
Yeah, it was a flu, called the Hong Kong flu. So, so what has surprised you? I mean, is it the sheer number of cases? Is it how far it's spread that's coming back?
I think what's surprised me the most in terms of the virus has actually been the etiology, where it infects the nerve, like there are signs of it infecting the nervous system. Even some of the early videos from China had some inkling that it was like there were cardiac effects. So some of that recent data was good to have in hand, but already, like, again, if you go to the original SARS, there were also cases where it affected the heart. But the nervous system stuff I was less aware of, so that's been surprising to me. And I guess, honestly, if I can be frank, like the public health response or the response from agencies like the CDC and the comparable agencies here in Canada that I'm getting familiar with slowly, I've been surprised, particularly like with the CDC, that there hasn't been a more organized approach. So I think for me, the surprises have been more on the public health response rather than the virus itself.
I think the virus has shown you really need a strong public health system.
Yes.
You really need national leadership,
Yes.
and which we don't have.
Yeah.
So this is an announcement to people. There's a Q&A box at the bottom. So please put your questions in there. Right now we don't have any questions, so please put them in. And do not put it in the chat box, because that's just for Roxanne and Joe and myself. So if you have questions, I'm going to talk for a few more minutes. And so please I'm sure you have questions, so if not.
And I'm happy to answer any questions.
Okay. Any questions? All right.
Yes, and any and all.
So you wrote an article about scary blood clots aren't that surprising. So you don't, the flu you don't get blood clots with. So that's a big difference.
Well, actually, there's some evidence that you might, because like, for example, if you get a flu shot, you are less likely to have a heart attack from a blood clot. Right. And so, I was actually surprised in reporting that piece that, like, there's evidence that other viruses cause blood clots, and particularly the protective effect of the flu shot. I mean, I got my flu shot this year and I had no idea that there was that cardiac protective effect from it. So, I think that the idea there was that we think that SARS-CoV-2 seems surprising. And in fact, there are things that make it unique. And I think that that's kind of it's like a constellation of things where it's a little bit more this, a little bit more that, but there's really, like, what I found in, my very first thing that I do is when I hear that there's like this weird thing that SARS-CoV-2 does, the virus that causes COVID, I go to PubMed, PubMed.org. The US government's put together this like really lovely assemblage of science articles. And I go there and I put into the PubMed search, the weird thing that the SARS virus does. And then I just kind of throw in other viruses to see if they do it too. So that's kind of one of the ways that I've explored the uniqueness and then the non-uniqueness, if that's a word, of SARS-CoV-2 is just, you know, being curious about other viruses maybe doing the same thing. Does that help answer your question?
Yes, it does. Yeah.
Awesome.
So I'm just curious about differences in countries, because we did interview a journalist in Sweden.
Wow.
So in Canada, well, I guess in Montreal, is mask wearing mandated? Is it universal?
So now in Quebec, we're required to wear masks in the supermarket. And can I make a confession?
Yeah.
So I was in the grocery store today, and it's a lovely little grocery store, and like the front of the whole grocery store is like open air, you know. But there was this young guy, and I think his girlfriend, and she was wearing a mask, but he wasn't. And I was just, you know, I know the owner of the place, and I walked in, and he said hello. He was wearing a mask. I was wearing a mask, and I kind of was like, can you remind that guy to wear his mask because it's mandated? But for the most part, people comply. I will say that I was for a while like the only person in my neighborhood wearing a mask inside the grocery store, but that's changed now.
Well, you know, all the stores in New York City, they won't let you in unless you wear a mask.
Yeah, no, yeah, for sure. And you know, I think part of the, again, just can I go back to what you were saying before about like what makes a virus unique and what doesn't? So when, you know, in February, one of the things that I was really what was happening in my head as I was walking around is I was thinking about this conversation I'd had with Lindsay Marr, who's like an aerobiologist, for a story that wasn't about whether COVID was airborne. It was about like how long it lasts on surfaces. And she just said in passing, like, you know, this thing about it being airborne and potentially airborne. And it reminded me that the conversation I'd had in 2015 with that virologist who made me afraid of pandemic coronaviruses, he was really stressing that the original SARS and MERS were airborne. So, you know, in February, I reported and gathered information on this for a piece that I wrote in March, it came out, I think, March 14th, about how I thought that we should be talking more about how it's airborne. So there was a long lag time between when I wrote that story and it published in Wired, and, you know, 4 or 5 months later, here we are, and like, we're kind of now wrapping our heads around it. But there was a while where I was going to the grocery store masked up thinking like, I wish people would read my Wired article because I really think this is airborne. But, you know, that's what happens, I guess.
Wired, I don't usually think of as a health magazine.
Oh, there's some great health. I mean, I read health stories for them, so
I know. Yeah.
maybe I can change your mind about that.
Okay, yeah. Anyway, so and what was the last story you just? What's the latest?
It's such a funny question because it took me like a few seconds as you were asking that question. I was like, what is the last thing I wrote? Like, I don't know. Does this happen to you, David, where like you write something and then you forget what you wrote like 2 seconds later?
As soon as I turn it in, yes.
Yeah, right. And in fact, for the blood clot story that you mentioned, while I sent my editor, Dan, a link, and I was like, yeah, it's kind of like this thing that like people published in 2007. And then he assigned me the story, and then I was going back looking at that link, I was like, wait a second, I wrote that story. So, you know, we journalists forget all the time the things that we write. But the last thing I wrote came out last week, and it was a long, like almost 4,000 word piece that appeared in Elemental. And it was all about why some people keep testing positive for their PCR tests, which is a way of like looking for genetic information in your blood or RNA of the virus, why those tests come back positive repeatedly for some people. So there was a woman in San Francisco, for example, who was a doctor, and she was testing positive 90 days out from her diagnosis. So she kept getting these positive tests. And the question is like, is there still actively replicating coronavirus in these folks, or you know, is it just the remnants or the debris of virus that's stopped replicating? And I found some really cool examples from like measles and Ebola and Zika, where the idea that viruses might persist in us a little bit longer than we originally think. And it could be just weeks longer, not necessarily years. But, I think that it's one of those things where we want things to be like black and white, but they're more grays in between.
So I'm going to take some questions.
Okay.
This is a question that someone wrote in and said, you tweeted last week that you had done 24 freelance stories so far this year. That's an incredible pace of work for any usual freelance year. And this one is not very usual. How do you stay so productive?
Oh, okay. I mean, I think everyone should find their own way of being the most productive they can be. And my way of doing it is kind of low tech. So I guess I'll do a little, can I do show and tell?
Sure.
Okay, so I have like actual notebooks that I use to write. I don't do any Zoom interviews really. I do it all over the phone, and I'm writing by hand. I'm not typing, because I feel like I capture information better when I write things by hand. And then I am recording things on like a little Olympus recorder, but I don't go back and transcribe interviews. What I do is I like look at my notebooks, and then I've starred key quotes, and then I'll put it away, and I'll take a piece of printer paper. I have a lot of like printer paper in my office. And so I'm not going to show you the notes on the other side, because like they'll probably look crazy. But I kind of do, like, after I do my interviews, I set aside my notebooks and I just kind of like do free recall in terms of what I think is important. And then I make an outline where I divide the number of words I'm assigned by 140 to figure out how many paragraphs I have to write. And then, sorry, the last thing I do is I go back to look at the good quotes that I have. I put them in a document, and I kind of have my outline in those quotes, and then between the two, I just put together the story. Is that a helpful answer? Because I feel like it's a little scattered.
Yeah, I think it's fine. Yeah.
Okay.
So someone asked, how do you know switching from editing to reporting would be, how did you know switching from editing to reporting would be the right move for you?
Oh,
What were
I did not. The answer to that is I did not. I still don't know. I mean, I miss editing. David, like, we worked together on stories where you wrote for Nature Medicine. And so I really enjoyed that process. I miss, chatting with writers and things like that. But, I didn't know. And I feel like I'm glad I did it. I'm kind of upset that there's a pandemic, but I'm doing the best that I can to contribute to the conversation. So I would say if anyone's kind of like thinking about making that switch, you can just try it. Like, listen to your heart, and I guess figure out. There's a lot of us out there that kind of want to do both, and maybe there's somebody out there that's finding the perfect balance between the two. But I'm like the kind of person where I can't really do two things at once. So for me, I really had to decide after being an editor for 12 years whether I wanted to continue doing editing or becoming a writer. So I just, I've been doing some freelance pieces while I was an editor, but like I said, I can't juggle things very well. So I was doing those on like my weekends and nights, and it was hard.
It says here, what were the worst parts about being an editor in your view?
Oh, the worst part. I mean, what were the worst parts? I mean, my first thought that came to mind was like just chasing the billing department if things were late for freelancers, because I really wanted people to be paid on time. But that didn't really end up being much of a problem as we kind of got a good system in place. I really liked a lot of things about it. I guess the only part is that I wanted to write too, and I didn't get a chance to. So that was really the only bad part about being an editor. I really liked all of the other stuff. Maybe like a little bit also like importing text into like the web publishing tool when we got one of those, only because like it's a little tedious. But that can also be fun if you've had a long day and you just want to do something kind of without thinking much.
So here's a question. How do you find ideas for stories outside of press releases and studies?
Okay, so I get actually 0 press releases. I have not received a single press release this year. I mean, I've gotten like 2 where people like looked up my email address and sent me a press release, and I was like, please don't send me any. I use 0 press releases in my reporting and story generating. And I say that like, you know, when I was an editor, I used to get a ton of press releases and, you know, from all the journals and the papers. But as a freelancer, I've decided that like, I want to just follow my curiosity. And so I saw a talk way back, like 20 years ago, that Natalie Angier, the science writer, had given. And she was talking about how her curiosity has, you know, drives her to ask questions, and then she ends up writing a story about the questions she has. So I literally just use my questions as leads for stories. And not, you know, there have been a couple stories. There's one story I did where I interviewed like 14 different scientists because I thought I had a really interesting question. This was this year. And I learned in the course of asking 14 different scientists, like, no, my question wasn't really that interesting. So there have definitely been false leads, but there's also been times where those false leads kind of come back to be more interesting later. And so I kind of try to not be too hard on myself if I come up with a question that's not that interesting.
Tell people during a pandemic, nobody should be hard on themselves. Just
yeah, right.
Be a little forgiving because it's stressful.
Yeah.
Here's another question. Do you have any advice for writers who want to write about science but don't have a scientific background? I mean, I don't have a scientific background. I have a master's.
Yeah, no, I mean, one thing I wanted to stress is like, I wasn't really a reporter until January. And so I kind of feel like anyone who's like wanting to dive into this stuff can definitely make it happen. Like it's, I think to ask, well, there's 2 things I'll say is if anyone, regardless of whether they have a scientific background or not, can use PubMed, which is a free tool for anyone to use. Also Google Scholar, but I happen to like PubMed better just because of the interface and things like that. Nothing against Google Scholar, which is fantastic as well. But you know, I don't think you need a scientific background. There's so many different angles to this pandemic, and as long as you're not afraid to ask scientists why, how come, how do we know that, and to probe those things, I think, you know, anyone can do that. And some of our greatest science writers right now don't have a scientific background.
Now, when people ask me, how can you write about science and medicine? And I say, people write about sports and politics.
Right.
And they're not athletes, they're not politicians.
Right.
It's the same thing. Here's a question from, do you have any opinions on reporters using preprint servers like Biorifics for COVID stories, considering that several poor papers have appeared there?
I mean, I have a lot of thoughts on this. I actually wrote a piece for the Open Notebook a couple months ago. People can find on my website in the stories links. I think I put it there. So I did actually, I had concerns about this or curiosity about this going way back, and like a couple of years ago, as soon as preprints came along in the medical and biology fields, I started wondering like how are we going to report on these things? And I don't think, I mean, I felt like I didn't have the answer, so I asked a bunch of different reporters for the story that I wrote about this, and I got like great responses from people. Some of it's like as basic as like using the right language to describe a preprint when you're reporting on it. So, you know, a preprint paper is more like, it's better to say maybe it's posted rather than published, just to kind of distinguish between, you know, the methods in which it appears online. And of course, like, you want to ask other scientists to contextualize it for you before you run with it. I think that some of the reporters that I spoke with for the story were really smart in saying, you know, it's kind of a little dicey to just run a story on one paper that's a preprint. So, you know, if you do that, you might want to really, really double check with different scientists to essentially give you like a mini peer review of like whether the methods section is good. Did they use the right methods? Did the results, are they supported by, are the conclusions supported by the results? So you're kind of looking at it with a close lens. But I think that, you know, some of the science writers I spoke with made the great point that you should be doing that for peer-reviewed studies anyway. because just because something's peer reviewed does not mean that it's great. So I think, well, I guess I should give a, a summary answer to your question, which is like, I think people should report on preprints just responsibly. Yeah.
Can you say more about how you came upon the videos from China?
Oh.
I had a similar experience and was shocked at the time by the extent of their lockdown in the absence of other information.
Yeah. So, excuse me. I came across the videos in China kind of just, well, I started really early on creating a list on Twitter where I followed a lot of reporters that were based in China. And I had a feeling other people weren't doing that. Like, I actually was a reporter in the Baltic states way back, like right after college. And so I have a lot of, I've seen on the ground, like how things can be different in a different location. Like, when I was over there, I was in a whole different news ecosystem than being in New York. So I wanted to know what was concerning the folks in Wuhan and, Beijing and different cities in China and in Hong Kong. Like, I just followed a lot of reporters there, and sometimes they retweeted videos. I would just kind of search on Twitter and just kind of look. Is that a good answer, David? Did I?
Yeah, it is. I mean, the videos from China, when I first saw them, were kind of shocking. I mean, there were people patrolling the streets. They basically, were aiming guns at people saying, "Get back in the house." It's not like,
yeah. And I was trying to kind of read between the lines, like, God, I mean, like some of the, I didn't share them that much on Twitter. I tweeted like, should I share these? But I felt like I couldn't, because these videos were like people keeling over, looking like they had like a heart attack, and a nurse just wailing because she was just so emotionally overcome, and hospital wards that were just overrun with patients waiting or like having breathing issues. I remember one video that I think is still online of a patient that he or she was recording as they were taking away another patient across from this like place where clearly everyone was suited up. And one of the comments on the video was from somebody who said they were a nurse or something, saying, "I can hear the breathing rate of the person taking the video, and they're breathing very fast. To me, they're not getting enough oxygen." So like all these things kind of really emotionally changed me, I guess, or informed me.
Do you speak to COVID patients?
I mean, I have. So, like my most recent story, I did speak with a COVID patient. I have a friend here that got COVID that I have been in touch with, and so I spoken with COVID patients both in my reporting and in my real life. A couple other friends got it. So, but I think my reporting has been mostly, cell biology. So.
Okay, so here's the question. In many fields, women say they are at a disadvantage compared to men. How is the science journalism field in that regard? How often are you aware of your gender within the work you do?
So I'm sorry, I missed the very first part of the question.
In many fields, women say they are at a disadvantage compared to men. How is a science journalism?
I see, okay.
No.
That's a great question. I have some thoughts on that I probably, I'll try to be as candid as I feel comfortable being. I feel to some degree that it is, it's not that different, but in other ways, if I can be frank, sometimes I think I worry if I talk to a source, if they think I'm not getting something, if there's a hint of gender bias there. And I think at one point in the last half year or so, I said to someone, I know I'm a woman, but like, I promise I will understand this. I think I had a conversation that it caused me some frustration. Whether or not I should have said that, I don't know. You know, sometimes I wonder if I don't know, I wonder if, you know, on Twitter, I think there have been studies that have shown that, like, you know, men have more prominence, and the causality of that's maybe not clear. But I'm curious about how people perceive the writing that people do and their authority based on their gender. David, I don't know if that answer is like really articulate, but
It's fine.
does it help? Does it help you understand anything on that?
Yeah. So I had a question. What guidance do you have for college health / science reporters covering campus reopening plans?
Oh, wow. Get writing is the first thing. I would say, don't be afraid to keep a notebook with all the questions that you have as you're thinking about this, because you might be, I don't know, eating breakfast and like you'll have an idea about the implications of the opening and you'll want to write down that angle. So, or maybe like keep a note section in your iPhone where just all the different angles to this, because I think that it's a story that's got to be approached from like 1,000 different directions. And the more angles that we're approaching it from, the better. And I was a college health and science reporter, and I think that one of the things I used to do was get comment from like the professors at the university that I was at on the topic I was writing from, and that might be a cool way for college health and science students covering this to kind of weave in the expertise from their own institution, and maybe at the same time you kind of get a 2-for-1, because you can also ask, let's say, the epidemiologist at your university or the biology professor at your university, how their kind of scientific expertise sits with their personal concerns. And also, you know, talk to your friends about what their questions are about the reopening, and your parents and, you know, family.
So here's a question. How do you maintain your emotional well-being while battling disinformation during a pandemic? That's a question. I wouldn't know how to answer that. Living in a pandemic is tough enough.
Yeah. I mean, I think in some ways reporting on the pandemic is like an emotional coping mechanism, because I mean, science writers were very fortunate because we have questions about the virus and we have a license to call people that are like the expert in their field and get our questions answered. So part of the way I've been coping with my, you know, concerns is by trying to get to the bottom of them through reporting. I think I mentioned on Twitter that like I do a little bit of carbo loading, which is a fancy way of saying I eat giant plates of pasta as I'm finishing edits on stories, because, you know, eating comfort food is part of the emotional well-being milieu, if you will, or like, I don't know, like it's part of the way I deal with it. And I Skype with friends, or I video chat with friends. I think actually the person who asked that question is a friend of mine who's been very supportive of me. So I text people if I'm having a down day. I'm really not afraid to let friends know, you know, when I need a little bit of human interaction. I actually go on morning walks with a friend up the mountain that's 3 blocks from my house. So I kind of try to look at trees sometimes and aggressively garden if it's not raining.
Some people, reporters, have told me in the call just that I'm really depressed just reporting on this, the sheer numbers, sheer cases, or family member gets it.
Yeah. No, I mean, I'm in a different place right now than I was about a week ago, because I had like a day and a half, or like 2 days minus the interview I did on Sunday off. So I'm kind of refreshed right now, but I think that like this time last week, or like, you know, even like Wednesday or Thursday last week, I was really looking to my science journalist friends, because I think in particular that them and like my researcher friends, and my healthcare worker friends, and my friends that are kind of enmeshed in this reporting and understanding of this virus, we'll all kind of share like you say, David, like this emotional exhaustion. And I mean, did you ever were you ever a runner?
I play tennis. Sorry.
Oh, tennis. Okay. That's a sport I'm terrible at. But and I'm also not that great at running, but I did do like cross country running in high school and like New York Road Runners things. And I feel like it kind of helps sometimes if you know how long this thing's going to go for, because you kind of set your emotional pace in some ways. And I think that I'm not like holding out for this to be over tomorrow. So in some ways that helps me emotionally, because I think that I wish it were over tomorrow, but I think that if I'm pacing my expectations over the next year or so, 9 months or a year, it allows me to not kind of wake up every Monday of the week and say, hey, how come we're still fighting this? And that can actually drain you. So maybe my pessimism has been like a nice protective thing. I smile a lot, but I'm super pessimistic on the inside.
How do you coax public health officials to share the results of their COVID interventions, particularly when the results may not be great?
I haven't really had to do that, only because I haven't written a ton about therapeutics. But I think that I think that if you ask people about their results and you kind of meet them where they're at and try to find out, I guess I want to know more from that person asking that question exactly what they mean. But I think if you meet scientists where they're at and say, hey, what were the results and why do you think that's interesting? Or, where can we go from here? That might be a way in to kind of getting people to open up.
Well, this person provided context. I'm not correct. It said, writing a white paper and literally any information is helpful as jurisdictions are rapidly trying to learn from one another. We also learn from mistakes, but can't seem to pin down the information I need. Unexpected reluctance, many dead ends. In public health, I know there's often reticence when it comes to evaluation. I'm not quite sure if that helped or not, but he says that public health officials are not always, eager to.
Well, yeah, I mean, when I wrote that piece about the airborne potential of this current pandemic virus, I called the WHO, and they're lovely people, but they didn't get back to me on my questions. I still ran the story. So, I had a French teacher in high school where if you couldn't think of the word in French, she would always say circumlocute, which means use other words to get around the word that you're trying to say. And I guess in reporting, if you can't get necessarily comment from the public health official that you're dying to get it from, if you get comment from 4 other folks that can kind of bridge around that, you can kind of at least get some context or give some context to the reader, where a bunch of different puzzle pieces together might make up for that one piece that you're lacking.
So what do you think is the most harmful misunderstanding the general public has about the coronavirus?
Well, if you'd asked me 2 months ago, I would have been like, it's airborne, or it's aerosols. Right now, I guess the thing that comes to my mind is how, it's not about the virus itself, but I really think there's been some great reporting by other people that are covering this pandemic about some of the racial and economic disparities that are kind of making people at risk of contracting the virus and not receiving the care that they need and things like that. So I guess maybe the biggest misconception is that it's only the virus that can't be stopped and that there aren't societal things that we can do. So I think that a lot of other reporters are doing great work covering that.
Who are the reporters you admire?
Oh, wow. Some of them are my friends. So,
Okay.
I like all of them.
Okay.
Well, so I think that Helen Branswell and John Cohen were like my lodestars at the beginning of this pandemic. Helen writing for Stat, John writing for Science. More recently, like there's too many. I mean, there's too many to name. There's too many. But like one of my best friends, Amy Maxman, she writes for Nature, and she did this story about prisons last week or 2 weeks ago that I thought was eye-opening. I really hadn't paid attention to outbreaks in prisons and how, she was reporting on the fact that like the test, like scientists were offering to test people in the prison, and then the officials were kind of saying, no, we don't need that right now, and how devastating that has been. So I would highly encourage folks to check out her reporting. Just a lot of people. Actually, if somebody wants to like reach out to me on Twitter, I can, maybe come up with a list of folks.
Well, I also think it's interesting is that COVID-19 is not a science story solely. I mean, there's politics, there's just, mental health aspects to it.
Totally.
We interviewed a psychologist about this. There's every kind of aspect. I mean, I haven't seen my kids since March.
Oh,
well, my son escaped to Cape Cod at his in-laws, so that's good for him.
That's nice.
My daughter had a baby in March, and she's kind of.
Oh, I'm so sorry.
Well, no, I'm happy she had a baby, but I mean.
No, I'm happy she had a baby too. I mean, I have a lot of empathy for that situation because my sister's having a baby. Like, she's actually texting me. She's texted me 30 minutes ago, but she was due last Monday, so it's like. But she's out in Colorado, and I'm not going to I haven't seen her during the pregnancy, and if I actually start thinking about it too much, I might cry.
Yeah, well, I mean, I feel very lucky because she gave birth early. She gave birth March 6th. If she gave birth on her due date, which was March 22nd, that would have been lockdown. Her husband could not have even been in the delivery room. So, I mean, this is a story that affects so many people. I have a 93-year-old aunt in Florida. I mean, and besides the pandemic, there's a lot going on in the United States anyways, with election going on. There's a hurricane coming. I'm thinking, can we just have some nice weather at least?
We should do like a Zoom chat in like 5 years and just look back and hopefully by then it'll just be like it's a lot like you say. It's when you pause to think about it. It's touching all of our lives.
So I think this is a good question. With so much attention focused on COVID-19, do you worry we're neglecting other good health stories?
So yeah, I mean, for sure. And again, there's been some reporting that folks have done. I read a piece, I forget who wrote it on, cancer patients who feel neglected. Some of the stories I've reported on of the 24 stories, I think a little bit more than half of those are on coronavirus, but some of them aren't. And some of them have been on cystic fibrosis and some of the drugs that have come out for that, some of the gene therapies, patients that are kind of living longer than expected. And, I guess when you ask that question, the cystic fibrosis community comes to mind because these are people who have already lived their whole life worried about infections of their lungs that are really serious and can be fatal. And I've been thinking about them all year and hoping that they're keeping safe. And so I guess as science writers, as health reporters, if you feel like you don't want to write about coronavirus, I think that is great. And I think that there's still an appetite for publications to run stories that aren't coronavirus. And I guess I'm writing about it, right? I'm writing about coronavirus a lot because I used to write, like virology has been something that I've covered and genetics and stuff like that has always been like my main, like one of my 2 or 3 main things. That's been one of them. And so that's why I've gravitated towards this. But I think that, there's definitely room for a lot of non-COVID stories.
So once every other week, the editor-in-chief of JAMA has an interview, live stream, and with Dr. Fauci. And Dr. Fauci is always he's very careful in what he says. And it doesn't have, I mean, and not because of Donald Trump, but he says, he's very modest. Like, I don't always know what's going to happen.
Yeah.
I'm cautiously optimistic about vaccines. I mean, he uses and sometimes I think it'd be nice to have a cheerleader, but I guess having someone very realistic. I mean, he's got a very high approval rating. People like him.
Yeah.
And and he talks about himself. He says he won't fly a plane because of his age.
Yeah.
And he also says that he's a runner. He runs.
He's a lot of things that I'm not.
A lot of things that none of us are not. Right?
I'm always cheerful and I'm not a runner.
Yeah.
No, but he's quite impressive. He's really he keeps in shape, and he's doing his best to keep the government going forward, fact-based. I've been, and he's a great science communicator. I don't know if you remember, he did that interview with Steph Curry, basketball star. And I thought that was great science communication. I loved that.
So here's a question. Has reporting from Canada changed the ideas or stories you've chosen to pursue read the pandemic?
I wished more so. Like there's a lot of different angles that I'd like to explore with regards to like Canadian healthcare and how that might have changed the path of this. And I haven't really, I mean, I would say that maybe I feel more connected to some of the scientists in Canada who are doing research in epidemiology and stuff like that, that are based here. And I've been kind of seeing, their perspective on things, but I wouldn't say, since so much of my reporting is about cell biology, and cell biology is the same no matter what country you're in, it's definitely not been influenced too much by where I am. But I'll say what's funny is I live in Quebec, and so when I walk out my door, most things are in French. And coming out from the real lockdown period where we're really at home, I went into a bookstore and I looked around and I was like, why are all the books in French? They have a really big foreign language section. And then it clicked and I was like, oh yeah, I'm in Quebec. So maybe as things kind of move along in the year, I'll be more tuned into what's going on here on the ground.
Do you speak French?
Enough. I mean, the other thing I'll say is I've been listening to podcasts. That's where I get some of my story ideas. So like the TWIV podcast, is amazing. TWIV for folks that might want to check that out. It's great. I mean, I remember listening to it where I was on my cross country skis, because before summer came along, the mountain near me has got like a cross country ski path. So I'd be listening to TWIV and cross country skiing. And then I was listening to Das Coronavirus, which is like the German podcast. And then there's also Info Coronavirus, which is the French one. So I kind of try to hear what different countries are saying, but mostly everyone's kind of saying the same thing. So
yeah, I mean, I found it very interesting. So in countries like France or Italy or Spain, they make rules for the whole country.
Right.
We don't do here. And do they do in Canada? Is it?
No, it's not. It's kind of very federal here, but even the health systems here are different from province to province. So I guess I wasn't how in the US there's HIPAA,
Yes.
Which is the Privacy Act. So what I learned since being here is that it's not even there isn't really a Canada-wide HIPAA. It's each province has their own health system and has their own HIPAA. So I'm not really that surprised that it's kind of like the US where it's state to state. The only difference here is the provinces are there's fewer people and the provinces are quite big. The territories, everything's kind of jumbo size in some ways.
So do your friends ask you, is it safe to do this? Is it safe to do that? I mean, people ask me all the times. I got a call from a journalist doing a story for WebMD, and she said, "Can I interview you about the subways?" And she said, what was it like pre-pandemic and what was it like now? And I said, I haven't taken a subway yet, but I'm thinking about it because they do clean them and there are very few people on them.
Yeah.
I have taken buses because you can open the windows and it's, I think they're a little safer. But I also took a ferry ride because there are ferries that go to Wall Street and people are commuting that way.
Yeah.
So, and again, it's really, you know,
Did you use the app? Because the ferry has a great app in New York.
does have a great app. Yeah.
Yeah.
It also goes to Hoboken and Astoria, goes to that one. So I think, it's interesting. There was an article on one woman, she wanted to go to a party in Brooklyn and she rented a moped, but you can't take it in the tunnels. And then she walked 3 miles. And I
Oh,
said,
wow.
it must have
You
been
know,
a
I
great.
heard they stopped the mopeds. I still listen to the Brian Lair show up here. So, I mean, even though I left New York in December, I'm still feeling really connected to it. And
But what I do find is that people, they look to us for that kind of information, which we're not really experts on.
yeah,
But I can just talk about my personal experience. But I do think that eating outside is safer than eating inside, as the governor said. But I don't know. I mean, I don't know. Some people don't do anything, and some people do things that I would never do.
I think my family and friends stopped asking me because every time they'd ask me, I'd be like, no, I'm not really doing that. No, I'm not like ready to do that. So I think they started to realize that they wouldn't get the kind of like, go for it answer that they were looking for. And there's been some good pieces, like the Washington Post, I think, did a story maybe a month ago where they asked like different experts what they were comfortable doing. And you saw Fauci respond to that. There's been, I think, some good communication in the last month or so. Although, as we were kind of hinting at, like there hasn't been a central. I mean, as I've been tracking the U.S. and stuff like that, a lot of countries haven't come up with centralized like information on this.
Well, I was very interested because yesterday I was in a Zoom talk and someone was saying that it's totally safe to be outside. The CDC has guides that, risky and not risky or riskier. And they said that outdoor dining is less risky than indoor dining, but still moderate risk. And so I was surprised how detailed they were. And I mean, as a tennis player, you're 78 feet away from the other person, but you're supposed to bring your own set of balls and it's just.
I've played basketball during, in like the aftermath of the lockdown. I've played basketball and, it's like you're a little bit more conscious of like other people and where they're at, like shooting the hoop. Like there's like hoops close to one. Like I remember the hoops I were at was like, there's 3 clustered around each other, and your ball goes into the other space of the. And you gotta pick your comfort zone, literally zone.
So so do editors come to you to do stories, or are you always pitching?
I'm besides. Dan had asked me to do that early story, and maybe a couple other times I've been saying stuff on Twitter, and will you write something on that? But I generally, I love to pitch, and in fact, I'll make a pitch about pitching. There's a book on my website that I contributed to, a chapter on pitching, and so I can actually, sorry if I can pull up information on that. So. See if I can. So yeah, if you go to the craft of science writing has a chapter that I wrote on pitching. So I love to pitch. It's a very long answer to your question, but
most people don't like pitching.
I like pitching. I don't like some other things about being a journalist. But I think that I mean, I used to teach and I used to say to folks like, your curiosity is probably the same. What you're curious about, somebody else is probably curious about. And if you do some vetting of your ideas and kind of put it together in your head and then send it out, I think.
I find,
and actually that, going back to the gender question, Laura Helmuth had a great piece and a great point a few years ago that really impacted me. And she said how the guys that would pitch her and she would say, oh, I don't think that story's right for us, would come back like the week later saying, here's another pitch I have for you. Whereas the women would feel more kind of gun shy after, I mean, I shouldn't use that phrase, like they were just more hesitant to come back with a pitch after getting a no. And I really took that to heart. And I was like, am I self-censoring because I'm frustrated by an initial no? And so I've kind of tried to be like, less discouraged if something doesn't work out and to come back with another idea.
What are you working on now?
I'm working on a couple things right now. There's a print feature that I'm trying to pitch. I went on a run earlier today. And so like, you know, when I go on a run, I go with like a printer paper of like the notes that I've scribbled and then my cell phone. And like, I'm kind of like, and by the way, my runs are like probably slower than most people walk. So I'm just like, you know, especially going uphill, it's very slow. But I was thinking about this print feature that I have an idea. It's about immunology. So there's that, and then there's another story that's more like really about the scientific models that people are using to study COVID. So that's more of a short piece.
Okay. So I get embargoed articles from Eureka Alert, and I find that very helpful.
Yeah, I actually, I mean, personally, like I say, everyone's kind of got a different method. I feel like I get distracted by that stuff a little bit. So, yeah.
So what is the Open Notebook for people who don't know?
Oh, well, the Open Notebook's basically like the best thing ever in the whole universe that I wish existed when I was starting in science journalism. And it's so that people should just like, if they've never heard of the Open Notebook, regardless of where you are in your science writing career, like it's got everything from like these cool profiles of science journalists where they work, so you can kind of see their office spaces and things like that, and to like, you know, deep dives into some of the ethical questions about science journalism and like how we approach things. They've got a whole pitch database, so you can like go read pitches that other people have written for other publications.
Where do you find the Open Notebook?
Oh, I mean, if you Google the Open Notebook, I guess I could try to find the URL. You're having me multitask, which I'm really bad at. The Open Notebook. So if you go to www.theopennotebook.com, you'll find so much there. Okay. So much there.
Okay. So do that. I think it's a good idea.
Oh, like I might do that later. I might unwind after this interview, this conversation. I mean, it's just like, you know, Siri Carpenter spearheads it, and there's Q&As with science journalists and health reporters. There's also like these things where they take award-winning pieces and like dissect them to give you like the inside scoop on how a writer came up with it. I found it like awesome. It's awesome.
This came out of National Association of Science Writers.
I am not super familiar with the origin story, and I wish I were. I know that Siri is very involved in NASW, and I think she might actually head the organization right now. So she would be the person to ask. She'd be a great person to have on this program. Yeah.
Okay. Okay. Just one more thing to ask. Okay, the Open Notebook. Thank you. So, any closing thoughts? Because we're getting close to your hour.
You know, like I guess the closing thought for me at this moment is this pandemic is, you know, it's like nothing we've ever seen before, and if there are folks listening that are science writers, health reporters, I think that tapping into this community that we have, because, you know, we're also, one thing we didn't talk about is like fighting misinformation. And I think that that's something that's been really demoralizing for a lot of us that have put our blood, sweat, and tears into like, you know, staying up late, calling people in Singapore, waking up early and calling people in this other place. And you know, like our eyeballs are burning from looking at like manuscripts of different science papers and finding So like we're putting a lot of effort into making these stories accurate and interesting and engaging and timely. And then we're fighting this misinformation that's going on online at the same time. So I think that the community that we have, that we're building and that we can tap into, and like if you're a health reporter out there who might not like know a lot of other health reporters, organizations and different, maybe going on Twitter or social networks, like finding friends that are also health reporters is a great way to steel yourself against some of the tough aspects of working in this area right now.
So someone did ask, is this a tougher time for freelancers because people are using all their staff reporters?
I'm a terrible person to ask that question because I have zero, like if I was doing a science study on this, I would have no control for that experiment, right? Because I basically started reporting just as the pandemic came. I mean, like like it would be a terrible experiment for me to try to comment on this. So I don't know the answer to that question, except to say that I think that people shouldn't be too discouraged about going for it. Like, you know, yeah.
So
Okay.
I've learned so my next talk is going to be on this book called Tomboy.
Wow.
Lisa Selwyn Davis is a science writer, and it's really good. I forget the date, August 19th, I think. But anyway,
Wow.
I'm putting out the announcement tomorrow. And I'm still hoping to get someone to talk about vaccines and vaccine production. I want to thank Roxanne for spending this time with us. We got a really great, a lot of people came to listen to you. This is being recorded. We will post it tomorrow on our SWINY's YouTube channel. And again, I want to thank Joe Bonner for making this possible, because I'm not that great when it comes to putting all this together, but this allows me to relax a little more when someone else is doing that part. So thank you very much, and stay safe, and I look forward to reading your next stories.
Thank you, David. And thank you for creating this space for us science reporters and health journalists to talk to one another and get together through this pandemic.
I'm imagining one day we'll have a dueling one with a couple different science writers.
Maybe one day we'll do this in person. That'd be pretty cool.
That would be nice. Yeah, that'd be great.
Hope you guys stay safe too.
Okay. All right. Take care.
Thanks for having me on.